August 1st is World Lung Cancer Day. So today we're talking about the latest in lung cancer care. Joining me now is Dr. Michael Marsh at Jupiter Medical Center. Thank you, Dr. Marsh, for coming here. We really appreciate it. It's so important to talk about. So first, let's start with talking about lung cancer in general. I think there's a lot of misconceptions that people who smoke are the main people who get it, but you're also seeing lung cancer in non-smokers too. Talk about
That's
that.
right. Yeah, thanks for having me, Stephen. Happy to be here. For all intents and purposes, lung cancer is primarily a smoker's disease, right? But we're seeing more and more patients who have never smoked in their life being diagnosed with lung cancer, especially today. I would say 10 to 20% of patients that we treat and diagnose with lung cancer have never smoked in their life. And there's a lot of factors at play there.
What puts someone at most at risk beyond the obvious smoking a cigarette, or are there environmental contributors as well?
So many factors, and like everything else, it's usually not just one thing, it's a combination of things. And genetic factors for sure play a role. We've identified some genes that play a role. So if you have this genetic disorder or lack of your body's ability to repair DNA properly, and you add insult to that, such as smoking or putting yourself in an environment, whether occupationally or recreationally, it can contribute to your risk of getting cancer.
Okay, and talking about age here, I think we tend to think older people die from lung cancer. They get your grandparents, I believe,
yes,
died.
Both my grandparents. Yeah, they both died within a year of each other, halfway through medical school, which heavily influenced what I do today. Yeah.
Are you seeing it in younger people too? Yes. Should younger people also be taking this seriously?
Absolutely. And there's a reason for the young people being diagnosed now. I think since I started practicing medicine 15 years ago now, and that was around the time we came out with lung cancer screening and some of the diagnostic tools that we're using today. In this past 15 years has been amazing with the advancements that we've seen, the therapies that we've seen. I think it's a combination to perhaps exposure, maybe chemicals, maybe things in our environment that could be contributing, on top of the fact that we're just so good at finding things now, incidental lung nodule programs where we're finding them very, very early. The technology is becoming very good. The imaging quality is good. We're using AI. So I think there's a combination for why we're diagnosing lung cancer early, and that's not necessarily a bad thing, because when we diagnose early, we treat early, and that's the best chance for cure. Lung cancer is a silent killer. It can take years and years before it even causes symptoms for you to go get that appointment to check things out.
And young people, vaping's a big thing with them. Is that a contributing factor too with lung cancer specifically, or is more studies being done on that?
We need more time, but inflammation is the key, right?
Okay.
Alcohol, smoking, anything that's going to cause inflammation is going to cause damage to cells. And when we ask our cells to repair themselves over and over again, that's when we get one cancer cell, and that cancer cell doubles to 2 and 4.
Okay. And lastly, we have limited time here, but I really want you to talk about Jupiter Medical Center really quickly and advanced screening and how people can take advantage of that.
I am a hometown kid. I grew up in Palm Beach Gardens, Jupiter, so very happy to be practicing here at home. The technology that we have for a community hospital rivals university programs, tertiary care centers. Robotic bronchoscopy is a big one. This made its way into the market about 6 years ago. We took early diagnosis to another level, now being able to more safely go after smaller lesion in the lungs. And the big topic now is endoluminal therapies. That's something we're also starting to offer. It's right now, we're on the horizon. I'm not going to be surprised in 5 years when endoluminal therapy is going to be one of the keys to cancer treatment.
Perfect. Sounds good. Thank you, doctor, for stopping by.
Absolutely.
Always a good topic to talk about. Thanks. You can find more information about Jupiter Medical Center and all the advancements in technology right now on WPBF.com or, of course, on our news app.